Well, India has broken its own world record for the most COVID-19 cases recorded in a day for a second day in a row. On Friday, a mammoth 332,730 new cases were actually recorded. Oxygen supplies and bed space is running out at most of the country's hospitals as they buckle under the pressure. Despite the rapid rises, mask wearing isn't strictly enforced and events involving millions of people are still being held. Well, Prasad Kunduri, former senior associate editor at the Tribune India, joins me now from New Delhi. Prasad, thanks a lot for joining us this evening. Obviously, coronavirus infections have soared once again overnight, setting a new world record cases. This is actually the third consecutive day. What's the situation like on the ground?
Well, as you said, good evening to all your viewers. It's really a situation that's bad. People are watching in the sense all the authorities are at work. It's in a way, if I can describe it, all hands on the deck. That's the situation because the number of cases, as you pointed out, are increasing by the day. And there are issues that have come up, largely, as you mentioned, oxygen supply. Ironically, there is no problem of production in terms of the oxygen. It's like 7,100 metric tons every day available, and of them only 4,000 is that is required. But what is the logistics is the one which is hampering the supplies, the lesser number of oxygen cylinders and the containers. So those are the logistics issues which are being looked at. So that's why you read reports which are numbing in terms of people having to suffer because of supplies of oxygen.
Yeah. Prasad, I wanted to stay on that point that you made around corruption and allegations of corruption. Who are the corrupt?
No, I'm sorry. There are very little issues as such as of now. I mean, there have been three reports of people being, there are reports in newspapers about some black market having occurred or somebody was, because the whole thing has been controlled by the government in terms of supply lines, supply chains, whether it's the vaccines and other things. What I said is in terms of the logistics of moving the oxygen from production plants spread across various states to hospitals. For instance, Delhi has very limited supply in the sense that supplies come from other states. So the logistics of moving the oxygen supplies in containers or in oxygen cylinders is what is causing the bottleneck.
Yeah.
Part of it is being addressed. For instance, today the Indian Air Force has flown in oxygen tanks, cryogenic tanks from Singapore, and also moving what's available internally. Several industrial groups are sending in the supplies because the government has also said to divert industrial oxygen, purify it and use it for medical use. So all those steps are being taken to augment the supply to hospitals.
Prasad, is it true that hospitals are now having to turn away patients? And what alternative measures of healthcare are being provided for these individuals that are being turned away?
Some of the hospitals have reported because of the high percentage of people requiring oxygen and the hospitals already under the number of patients who have to be dealt with. There have been periodic reports coming in from various hospitals about the supplies running slow or the supplies will not last X number of hours. So they're appealing to authorities to quickly move in supplies. In fact, in a city like Delhi, the Delhi police and other people are making arrangements to find a green corridor for settlement of oxygen. As I mentioned, the issues of the tanks, but I must also say there are some heartening stories coming across from various parts of this country, including Delhi and neighborhoods, where people who have oxygen cylinders are trying to supply it free. And in some cases, some of the social service organizations are helping out patients who are reaching their spots to give them some immediate temporary relief till they are able to get to medical assistance. In addition, some of the private entrepreneurs are now looking at augmenting supplies to oxygen concentrators. Social service organizations are donating it. These are steps that are being taken. There are, as I said, some heartening stories, but surely there are the reports of heart-wrenching reports of people having to suffer because of lack of oxygen.
Yeah. And Prime Minister Narendra Modi has been criticized for being largely silent about the real challenges brought on by the pandemic, also being criticized for allowing even the large gatherings that we've seen recently. What has government's response been thus far on the soaring numbers of COVID-19 infections?
Well, I think as of now, what we're looking at is the government and the entire machinery, as I said, is on all hands on the deck. They're looking at the problem, they're trying to attack the problem and ensure and work to a situation where situation is controlled. Criticism has been there. Much of the opposition has already been sharp in its track. Some of the posts on the social media do express the anguish people are expressing. But the government has put its head down to the task, as it appears, and working itself joining an issue, because there would be issues. But right now, I think the whole thing is to provide succor to people.
We leave it there. Prasad Kunduri, former senior associate editor at the Tribune in India.